2 million Americans and many more millions worldwide suffer from spinal stenosis, a narrowing of the interior spinal canal which blocks circulation, resulting in unbearable pain and lost mobility.
That space gets taken up to the point where the nerves can't get the blood supply in and out. Then you get this syndrome, which medically we call neurogenic intermittent claudication, which just means you can't stand, you can't walk, you can't go into an arched position.
Daily activities mean constant agony, and it doesn't get better with time. Quite the contrary.
I would be walking several blocks, and pretty soon I was down to only being able to walk a block, and then pretty soon I was only walking maybe half a block.
Then along came the X-Stop titanium spreader. The FDA-approved device is a 2-piece, 1.5-inch long insert which is implanted in the lower back and limits the extension of the lumbar spine.
So if the patient comes in and they say, "Doc, I'm okay as long as I can sit, but as soon as I stand or walk very long, I have to bend over or sit down." This is the perfect patient for the X-Stop device because all we have to do is identify the abnormal area, put the device in. If the patient's comfortable sitting, then the device will work.
The minimally invasive procedure, developed by Dr. James Zucherman of St. Francis Medical Technologies, is proving to be a cure for debilitating back problems.
So the first thing people usually tell us after the procedure is the first time I've been able to stand up straight for years. One fellow who came to me, the first time I saw him, he was curled up in a ball on the floor. And after the procedure, he returned to his usual activities, which is windsurfing every other day and hang gliding the rest of the days.
It would take a lifetime to see all the sights and explore all the trails the San Francisco Bay Area has to offer. Tessie Rodriguez was well on her way, though, with a passion for anything outdoors. That is, until spinal stenosis set in. Tessie suffered 3 strokes which left her blind in one eye, but it was the pain emanating from her back which eventually kept her bedridden for 20 hours a day.
Well, the leg pain was excruciating. It's hard to describe. It's a blessing that after you have pain, you usually forget it. But I can recall when I went into the hospital that morning, I could not walk across the street. I barely made it to the car to get there.
Shirley Streifer was already a veteran of traditional back surgery. Prior to the X-Stop procedure at St. Mary's Medical Center in San Francisco, her options were limited.
My alternative to the X-Stop was a fusion of 4.5 hours of surgery.
Okay, Shirley, let us know if you have any discomfort.
Instead, Dr. Zucherman inserted the X-Stop under local anesthetic.
The incision is about 1.5 inches long, and then we simply spread the tissue down to this thick tissue called fascia, and then we simply go on either side of it. So we make a cut on either side of it, leave it in the middle, and then just spread the muscle off the side. And then we simply put this right angle probe in, and then we check it on the fluoroscope, see it's sitting in the right place. And I feel with my hands as we're spreading the bones apart where the ligament's elastic limit is. The elastic limit is the limit of the ligament just before it's about to fail.
The outpatient procedure took less than an hour.
Then we just take the distractor out and then place the main body of the X-Stop, which is a bullet tip on it, and the little tip I can feel through the space I want it to be in, and I feel with one finger where the tip is going to go. So then we just pop it in the space.
Following a short recovery time, there's a rediscovered freedom of movement.
3 days later, I walked 3 blocks, the next day 4 blocks, and to me it opened the gates for me, let me out of prison. That was the best thing that's ever happened to me.
The waiting list for the X-Stop grows, and in less than a year, Dr. Zucherman has trained more than 500 surgeons in the revolutionary procedure.